Good morning, everyone. Thank you for being here. This is really a beautiful morning in Seattle, but the most beautiful thing is to see all these people here to get their vaccinations. And it gives us all so much hope. There's a number of people I'm going to thank at the end of this program, because this wouldn't happen without the concerted effort of a number of people. But we in the city of Seattle led the nation in trying to set up our testing facility sites. And we've now given over 600,000 tests. Our firefighters got trained up. You'll be hearing from them. They have just been remarkable partners in this. And today you're seeing the work that they're doing on vaccinations. The city of Seattle is working together in partnership with so many people to make this happening, because we know vaccinations are our hope. That's what's going to get us back together as a city. We'll be able to reopen, spend time with our families and friends, open our small businesses back up and support each other. I really have to thank the firefighters. When we stood up our mobile vaccination teams, their first thing was to go into one of those places that had those frontline healthcare workers and vulnerable citizens and residents, but who didn't have access to the vaccine. That was our adult family homes. We had our healthcare system set up to do our frontline workers. We had firefighters to do each other. We had a whole system in place, but in this system, there's gaps, and that's where the city of Seattle is trying to step in. So that first gap was the adult family homes. And our fire department has been so efficient that they were able to complete that task ahead of schedule. So we're starting this next phase, and you're gonna hear from Sterling Harding, who is the head of 775. I wanna thank her and 775 for their work, but not just for this today, but the home health care workers have been a critical lifeline for the people they serve. They are so important to families, and it's been so even more important during the time of COVID. But yet we didn't have a system in place to make sure that they and the people that they were caring for could get vaccines. And this shows you the power of organizing. Because if 775 had not organized these home health care workers so that they could provide adequate care for the people who needed it, so they could have a family wage, we also wouldn't have people be able to turn out like this. And we'd have those gaps in our system for the people who needed the vaccine most. So I just got to tell you, Sterling, thank you from the bottom of my heart. There's so many people you're going to hear from today who are just terrific. You'll hear from the Seattle Fire Department, from Brittany of 775, who is, herself got vaccinated this morning, which is so exciting. You'll hear from our firefighters. Kenny's here today, I think. Is he here? Right behind me. Good. So we'll walk through this. They'll introduce themselves, but I just want to say again, our chief, who couldn't be here today, really has led this department together with Brian Wallace, Dr. Sayre, but all the fire department has stepped up here, but they couldn't do it. And the reason they're doing it is because of those people who are providing such essential care for our community. So it's a great day to be here, and with that, I'll turn it over to Sterling.
Thank you.
Thank you.
What a gorgeous day to get a bunch of caregivers vaccinated. My name is Sterling Harders. I am president of SEIU 775. We represent 45,000 caregivers across the state of Washington. In-home caregivers take care of older folks and people with disabilities in their own homes. So caregivers are doing the important work of keeping folks safe and healthy in their own homes. And the work that is done day in and day out by caregivers helps keep case numbers down and helps keep us all safer. Home care workers are healthcare professionals, and the state recognized this by putting caregivers in as the first tier to get the vaccine. Like other healthcare workers, caregivers have been prioritized as 1A, and that is recognition of the absolutely essential work that caregivers are doing during this pandemic. But the fact of the matter is that caregivers have had a hard time getting access to vaccines, even though they've been prioritized as 1A. And that is why we are so thrilled to be able to partner today with the city and Mayor Durkan, as well as our union sisters and brothers at Seattle Fire, to be able to do this pop-up clinic to get caregivers vaccinated. So again, thank you, Mayor Durkan, for everything you've done to get this rolling. Thank you to Seattle Fire. We're so thrilled to get a bunch of caregivers vaccinated today. I'm going to introduce Brittany Williams, who is a caregiver and SEIU 775 union member and who lives in the city of Seattle. Brittany?
Nice timing for the planes. My name is Brittany Williams, and I'm a home care provider and a concerned Washingtonian. Okay. I know, the plane just... This is Washington for you. So my name is Brittany Williams. I'm a home care provider and a concerned Washingtonian. As a member of SEIU 775, I understand more than ever that the work that caregivers are doing, like myself, is very important. We work face-to-face with our clients, unable to social distance. That is why today, like so many others, I have come to receive my vaccine. I just recently learned that my great-grandmother is COVID positive. And this made me even more determined to see this out and to get it done. Yes, I understand that fear comes with this, but I want to reassure you guys that we have an opportunity to change the tide of COVID. We look at this pandemic from the start, and you know what? Caregivers have been fighting and continue to fight to be seen as the essential workers that we are. And after winning PPE and hazardous pay and being prioritized today as the essential workers by the city of Seattle, it's a big deal to us. It shows that caregivers are now being seen as the essential healthcare workers that we have always been. We must not give ourselves over to the fear tactic. As a home care worker, I could have easily gone back in March and hid in my house. But no, the hearts of caregivers consist of mercy, compassion, and understanding. These are the principles that carry us through these tough times. Yes, we have brothers and sisters that are COVID positive in our field. And yes, we have lost clients over the year to this. But as a mother, in the back of my mind, I put my children at risk. But when I think of my clients, I know that the risk is one that I'm willing to take every day. Fear will never win over our mission to provide care. We continue to fight to bend the curve of the uprise of COVID. We need to be shielded, and this shot is part of the shield. A shield that not only protects me, my clients, and most importantly, my children. Washingtonians don't have to be guilty. We don't want to be guilty of signing someone else's death certificate because we are COVID positive or we're asymptomatic and didn't know. I am so thankful that caregivers like myself have the opportunity to get vaccine today. I encourage all my caregiver brothers and sisters to sign up for your shots as soon as possible. It's not just important that you wear your PPE and that you practice proper hygiene. It is important that we all shield up in every matter of that word, because each and every one of you matters. Thank you. Now I get to introduce one of our heroes and frontline workers, Kenny from our fire department.
Good morning. My name's Kenny Stuart. I'm the president of Seattle Firefighters Union. I'm a lieutenant at Ladder 8 in Ballard, and I'm proud to be here today and proud to be a member of the Seattle Fire Department. And I'm also proud of my brothers and sisters, like Brittany, who are taking care of folks every day and braving those circumstances. And we're really happy to be here as firefighters to help take care of them and provide that shield, as Brittany said. I want to recognize Mayor Jenny Durkan and our Fire Chief Scoggins for the leadership they've shown in really leading the country in responding to the pandemic, as well as Dr. Michael Sayre, who our medical director, for his careful, considered, expert guidance in the program, and Lieutenant Wallace, Brian Wallace, for organizing the testing sites and this vaccination program. But most importantly, I'm here to recognize the firefighter, paramedics, and EMTs who are delivering the COVID vaccinations and have been doing the COVID testing while continuing to respond to the everyday emergencies that are continuing. We're going to remember much of this pandemic as phases. You know, I remember when it first started. I remember when we started having to wear masks. I remember when I was building that planter box in my backyard. But firefighters, we deal in seconds and in minutes. And we're going to remember things in moments. We're going to remember, for example, performing CPR in a small room in someone's house with 8 to 10 firefighters and paramedics crowded around a patient, taking care of this individual and finding out later that they were COVID positive. They're going to remember a house fire similar to the one that happened the other day where a young man was in critical condition and they rescued him from the house. And after the fire, when they came together to try to process this terrible thing that happened, there were no hugs or handshakes. There were just eyes peering over N95 masks standing 6 feet apart. And they're going to remember things like responding to a gentleman and treating him in front of his family in his house for a respiratory illness and having to intubate and put him into the back of an ambulance, knowing that the family would not be able to go to the hospital to comfort him and probably would likely never see him again. So firefighters are not only proud to play a key role in vaccinating our brothers and sisters of SEIU and the entire community for the betterment of the city, but because we're again very excited to be on the front lines of dealing with this pandemic and mitigating the effects of it. Over the past several months, firefighters have led the effort to provide free walk-up and drive-up COVID testing on top of our regular duties. Fires, heart attacks, car accidents, hazardous material spills, none of that stopped when the pandemic began. Now that there's at least 2 vaccines ready and available to fight the coronavirus pandemic, firefighters are once again here on the front lines as part of the department mobile vaccination teams. Today, firefighters are going to vaccinate hundreds of home healthcare workers who are also our brothers and sisters of SEIU 775, who are taking care of these vulnerable populations and do so at great risk to themselves. We are proud to help in these vaccinations, and we're really excited that it's a sunny day, number one, but that so many people have come out, and as Brittany said, they are excited to be here. They lined up early, and they recognize, like the rest of the city should, just how important it is to get vaccinated, to continue wearing your mask, and to continue following all the restrictions. So it's our honor, and it's my great honor representing the more than 1,000 Seattle firefighters in the city of Seattle to work with Mayor Durkan, our Fire Chief Scoggins, and the entire team, along with our brothers and sisters in SEIU 775, and the tremendous work and efforts of Seattle firefighters as we continue to respond to the pandemic. Thank you. And I'd like to now introduce our esteemed medical director, Dr. Michael Sayre.
Thank you. I'm really proud to be up here today and to recognize the willingness of the home workers in SEIU 775 and how they are going in to take care of vulnerable people every day. They are putting their own lives on the line to help keep people safe. And one of the key things that they're doing is getting vaccinated. Vaccines are safe. Vaccines are highly effective at decreasing the severe illness from COVID-19. And by getting vaccinated, these workers are not only protecting themselves, but importantly, and maybe even more importantly, they're protecting others. They're making sure that they don't go into somebody's home and spread the disease to this vulnerable person who might not be very able to deal with it and could die. So I'm really proud that so many people have showed up today to get this safe and effective vaccine. I'm sure some are worried about it. Many will experience a sore arm. A small number will get maybe a bit of a fever for a day or two, but those things will pass quickly, and they'll be able to resume their normal jobs knowing that they're protected from this disease. And by getting as many people possible vaccinated over the next 6 months or even longer, it will mean that we can reopen and resume our lives. I know many people out there wonder, like, well, how come these people are getting vaccinated ahead of me? And it's hard. There's just not enough vaccine to go around yet. And we need to think through like how we can protect the most vulnerable people, the ones that are stuck in nursing homes, stuck in adult family homes, or in their own homes and are not able to get out, and are really vulnerable if they get the disease to dying. So that's why we're prioritizing certain kinds of workers first, so that we can protect the most vulnerable among us, which really speaks to our society and the kind of people that we are as Americans, as Washingtonians, and as Seattleites. So thank you all for being here today, and thank you for getting vaccinated. Okay, turn it back over to Mayor Durkan.
Thank you very much. If there's any questions, I kind of MC. They can be to any of the people who have spoken here today. Happy to hear. And I also want to thank everyone who's here socially distancing. It's great to have an in-person press event again, and I really respect that people are doing what they need to do to keep people safe here. So thank you for that.
Have you been vaccinated, Mayor Durkan?
I have.
Have you received both doses?
No. It took a while for the phases to get in because of some of the health conditions and other things in the factor. But I want to encourage everyone. I think Bailey said it the best. Shield up. And today we're seeing those in-home caregivers who are touching hundreds of families in our city and our region. And keeping them safe is so critical. So I just want to thank them again for doing what they need to do to keep themselves safe, to keep their clients safe, and to work to make this a stronger city. Thank you.
Will there be more of these type of sites for home healthcare workers in the near future?
We're working as quickly as we can. We get 1,000 doses a week, the city of Seattle. And so we're really looking for those opportunities where we can do events like this to get a number of people. And again, I want to thank 775 because without that, we would have been trying to go into hundreds of individual homes, but they could bring the workers here, which is great. So we're going to be looking for opportunities like this in those places where we can. Eventually, the city of Seattle would like to be doing 1,000 doses a day, but we need to get more of the vaccine.
How difficult has that been with the short supply of the vaccine? I know other counties and areas have been a little frustrated because of that.
I think everyone's frustrated with the shortage of vaccinations. I was pleased to join with a group of mayors last week that went to the Biden administration and said, here's what we need in cities and locations. And so we're hoping to get direct access to the vaccination. As everyone knows, there's been confusion. There wasn't the stockpile that we thought that there was. But I think that's going to get sorted out in the next 2 weeks. There's also another vaccination coming online in the coming weeks. And so we'll have a third option as well. Any other questions?
I wanted to see, and I'm sorry for switching gears, but to get your reaction on the demonstrations on Wednesday, potential demonstrations happening later this afternoon, and kind of your thoughts on that.
So I think that we've, since the beginning of this period of time, we've been very clear that the right to protest is a cherished First Amendment right in our city and in our country. And there have been incredible reasons for people to speak out at this time. And we have seen tens of thousands of people in the street coming with peaceful demonstrations, raising their voice for justice against racial disparities, and to really make sure we do our part as a city to dismantle systemic racism. And we have seen some demonstrations where that's not the case, and I've spoken loudly and clearly that we do not believe that people should be doing the kinds of vandalism and direct actions that we've seen. And I talked to Chief Diaz, he's working on other strategies for that. But we have to make sure that we distinguish between what we've seen in this region, which is many, many, many peaceful protests raising their voices for justice.
Any other questions?
We've got one in the back.
I have a question because my husband around with my parents and my parents-in-law, and they are high risk. When he can get his vaccine?
Yeah, if you don't mind staying put, and I'll have Dr. Sayre, the fire department, learn a little bit more so we can give you that information. Okay, thank you very much. Thank you everybody for being here, and I really want to thank the frontline workers for being here. Thank you for all you're doing.